each hospital is different. Every hospital is different. They all have their way of keeping the charts, keeping the medical records, and you have to know when it comes from a different hospital or a facility. You have to learn how to read their records. So everything is different. We don't have any kind of consistency in hospital records, physicians' records. They're all have their own programs.
Health information exchange would make it easier for people in rural areas in order to get their care to them and for them in a more efficient way. I did an internship a couple years ago at CUPHD in Bellwood, Illinois, where we worked on trying to get electronic medical records to different areas, and one of the biggest barriers we had is that there isn't a really efficient way for different practitioners to communicate, and so improving health information exchange would be really great to make care more available to those people that really need it.
Our dog recently went to a new veterinarian, and about 2 weeks after his first visit, we received this card in the mail. And the card's very much like my driver's license. It has a very nice picture of my dog, his little portrait, and it has his birth date, his sex, his weight. Also on the front of the card is a list for the coming year of all the dates that vaccinations or other tests are due. So we know when he's supposed to have his rabies shot. Then when you flip the card over to the back, there's a website listed. And below the website is my dog's ID number. And it also notes that his password is my wife's email address. So we can take our dog to any vet in the world. And if that veterinarian has internet access, he can just call up the website, put in my dog's ID and the password, and have access to his total health records.
The place that I work, the nursing manager invited all staff to get adult immunizations for free, and I wanted to take advantage of it, but she needed to have access to my immunization records, and so I had to fill out all this paperwork from my provider and from this college that I went to school for undergrad to get my immunization records before I could even take advantage of this program. So it was just kind of a hassle, and I wish that we could have just accessed them a lot easier.
Luckily, I'm a health professional, and I knew ahead of time to have records, copied off for her. They were all amazed when I just handed them a list of her medications and her health history. But so many people don't have that advocate, and I can just see it being one more frustration for especially for our seniors, for anybody, but especially for our seniors that don't have anybody to advocate for them.